Over 27 million people around the world are needlessly blind. These people suffer from intolerable disease and illness that have long been marginalized or eliminated in the Western world. Vision impairment has grave economic consequences for individuals, families, and societies. This is of particular relevance in developing countries, which are home to 90% of the blind population. The link between poverty and blindness has been well documented, and recent research estimated the cost of global blindness at $42 billion in the year 2000. Without dramatic action to reduce the prevalence of vision problems, it has been projected that the annual costs will rise to $110 billion by 2020. Cataract, an opacity in the crystalline lens of the eye, is the single most prevalent cause of global blindness, accounting for nearly half of all cases. Significantly, cataract is also a curable form of blindness, and numerous groups and organizations worldwide are striving to meet the challenge of reducing its contribution to vision impairment. India is a shining example of the success brought to individuals and communities through cataract surgery. In particular, a striking relationship between blindness and poverty was revealed by a survey at the Aravind Eye Care Hospital in Madurai, India. It was found that 85% of all males and 58% of all females who had lost their jobs due to blindness regained their employment following cataract removal. Socioeconomic impacts of blindness prevention and treatment are not limited to cataracts. Onchocerciasis, with an infection rate of approximately 17 million, is a parasitic disease that affects populations living along riverbanks. This potentially blinding disease is endemic in 30 countries in Africa, as well as existing in South America and Yemen. Since 1987, Mectisan, the drug responsible for the treatment and control of this disease, has been freely available through the groundbreaking Mectisan donation program. Following the development of this desperately needed drug, the pharmaceutical manufacturers entered into an innovative partnership with the WHO, UNICEF, the World Bank, and ministries of health throughout the developing world. This partnership, along with the Onchocerciasis Control Program, has successfully distributed Mectisan across West Africa and brought much-needed relief to those in need. In more recent years, the fight against onchocerciasis, or river blindness as it is commonly known, has been extended throughout Africa by the African Programme for Onchocerciasis Control, APOC. Through global partnerships and efficient antibiotic delivery, it is hoped that this disease will be eliminated within 10 years. In 1913, US President Wilson signed an act designating funds for the eradication of trachoma, a potentially blinding infection of Chlamydia trachomatis. This infection, which is suffered by an estimated 146 million people, can manifest itself in the patient having inturned eyelashes, for which eyelid surgery is needed to prevent blindness. President Wilson's policy provided an opportunity to confront a painful, intolerable source of suffering for many people throughout North America. Today, trachoma has been almost completely wiped out in the United States. Sadly, the same cannot be said for countries in the developing world, and approximately 5.9 million adults around the globe are still blind due to trachoma. Nevertheless, through a combination of surgery, antibiotic treatment, facial cleanliness, and environmental improvement, this disease can eventually be eliminated from these communities. This strategy, known as the SAFE approach to trachoma treatment, has already produced remarkable results in a number of African countries. Moreover, the World Health Organization's Global Elimination of Trachoma program aims to rid the world of this problem by 2020. The hard work and dedication of many of the candidates for this year's award is making this possible. In the 1970s, pioneering work in Indonesia by Alfred Sommer showed that vitamin A deficiency, another cause of preventable blindness, was far more common than previously thought. Crucially, he also discovered that this problem was related to child mortality. A deficiency of vitamin A causes xerophthalmia, in which tear production dries up so severely that the cornea opacifies. When left untreated, it provokes blindness in almost 500,000 children annually, of which 70% will die within 1 year. Yet the intervention is simple. It takes only 2 doses a year of vitamin A supplement to prevent blindness, at a cost of less than $1. Worldwide, many NGOs are engaged in the fight against childhood blindness and mortality, and the provision of vitamin A is a crucial step in this battle. Throughout the world, both children and adults are at risk of other potentially blinding diseases. Age-related macular degeneration, diabetic retinopathy, and in particular glaucoma are all major factors. In the long term, the most effective way of combating blindness in the developing world is to provide the communities themselves with the correct tools to confront the problem. Many of the groups or organizations that were considered for this year's Antonio Champalimo Vision Award have excelled in demonstrating sustainable, reproducible models of eye care that have brought relief to communities in need.